Hi everyone, welcome to my YouTube channel. I am Dr. Rajiv, specialist in physical medicine and rehabilitation. In this video, I will be discussing various types of splints used in upper extremity disorder. As you know, so many multiple choice questions have appeared from this topic in various competitive tests. The first splint that I am going to discuss today is the aluminum finger splint. Aluminum finger splints are employed for the non-operative treatment of phalangeal fractures, minor sprains, and post-surgery to provide protection, support, and immobilization. These are constructed from malleable aluminum that can be molded onto the fingers and can be secured with Velcro straps. In addition, they also have soft padding, and the holes provide adequate ventilation. This is a J-shaped aluminum splint that may be used in the non-operative treatment of closed mallet finger injuries. The PIP joint will be immobilized by this splint, whereas other splints such as stack splints will not. Some researchers suggest splinting the PIP joint in moderate flexion and the DIP joint in slight extension for mallet injuries treated non-operatively. This is a dynamic joint extensor assist splint for the PIP joint or reverse knuckle bender splint. The purpose of this splint is to enhance extension ROM in PIP joint stiffness in flexion. As you are aware, PIP and DIP joints are commonly referred to as knuckles, similar to MCP joints. Thus, the name of this splint includes the word knuckle. Sugar tong and Munster orthosis. The sugar tong orthosis consists essentially of a long and narrow thermoplastic sheet shaped like a sugar tong. The thermoplastic material is positioned beginning at the dorsal metacarpal heads, along the dorsal aspect of the forearm, around the posterior elbow, capturing the medial and lateral epicondyles, and placed along the volar aspect of the forearm, extending to the volar palm. Munster orthosis is essentially a wrist orthosis with long proximal extensions that converge on the medial and lateral epicondyles at the distal humerus. Munster and the sugar tong orthosis were designed to prevent full forearm rotation, providing stabilization of the radioulnar joint and immobilize the DRUJ, distal radioulnar joint. Nonetheless, they permit limited active flexion and extension of the elbow. These splints may be used in TFCC tear, that is triangular fibrocartilage complex tear, also postoperatively after Gillespie fracture dislocation surgery, and distal radioulnar joint fractures treatment and dislocations. This is the Samiento brace, which is used in the treatment of fractures of the shaft of the humerus. Coaptation splinting will usually be done until the immediate post-fracture pain and edema have subsided, mostly within 3 to 7 days. After that, the patient will be fitted with a functional brace such as a Samiento brace. Most humerus shaft fractures are treated non-operatively with an expected union rate of 90 to 100%, though surgical fixation by either intramedullary nailing or plating is necessary if the fracture is segmental or the vasculature is compromised. Fractures that persist in unacceptable cosmetic or radiographic deformity after the brace has been applied should be evaluated for surgical intervention. Airplane or aeroplane splint is a shoulder abduction splint that is sometimes used in brachial plexus injuries, burns management, and for the prevention of contractures of the axilla. The smaller version of this splint is used in the management of Erb's palsy. In this case, the shoulder is kept in 90-degree abduction, externally rotated, elbow flexed at 90 degrees, forearm supinated, wrist extended, and the hand and the fingers also extended. What is an ulnar gutter splint? Let us see. An ulnar gutter splint is most commonly used in the non-operative management of 4th and 5th metacarpal and phalangeal fractures. The U shape, which resembles a gutter, is what gives the name gutter splint. This will accommodate the edema that may occur following fracture at the same time, providing support, immobilization, and protection. The ulnar gutter splint is positioned on the ulnar surface of the hand and forearm. Boxer's fracture is a fracture of the 5th metacarpal. This ulnar gutter splint, designed with a breathable fabric and velcro straps, can be utilized during functional training. After using the long gutter splint mentioned earlier, this is sometimes employed as a weaning splint. The use of a radial gutter splint is meant to fix fractures that affect the second and third metacarpals and index finger and middle finger phalanges. It is applied to the radial surface of the hand and forearm. A dorsal or extension blocking splint is an orthosis applied on the dorsal surface of the hand, wrist and forearm to prevent or limit extension of the wrist and fingers. This splint is frequently employed after repair of the flexor tendon in the fingers for support, protection and immobilization, thus preventing tendon rupture. The use of this splint extends to the rehabilitation phase and as a night splint. These splints are useful for different types of dorsal blocking advocated by the Kleinert, Modified Durand Protocol, Indiana or Manchester Protocol. This splint is also used after nerve repair. This is an arm sling most commonly used to support the shoulder and forearm pre as well as post-operatively in shoulder and upper extremity injuries. This is another variation. The trowel supports the forearm but shoulder support is very minimal here. If the trowel is small, the flaccid hand and fingers will droop, for instance in stroke and other paralytic conditions, so it is better to include them as well inside the trowel for better comfort. The sling and swathe support is designed to immobilize the shoulder and arm. This is used in shoulder dislocations, fractures of the shoulder and upper arm, sprains, etc. Swathe means a large band or strip. By using the swathe, the arm is kept close to the body and the shoulder and arm are prevented from moving. What you are looking at now is the Babath shoulder support sling. This shoulder support is intended to support the subluxated shoulder in stroke patients. Subluxation of the shoulder is a common occurrence in stroke patients, which can cause pain and lead to complex regional pain syndromes. The sling has a roll-like pad at the axilla that keeps the shoulder abducted. The shoulder is held steady by the long strap around the neck, preventing subluxation. A variety of shoulder supports are available, some of them with straps that elevate the shoulder joint, which aids in preventing subluxation. A suitable one has since been found at, and every option that is available has its advantages and disadvantages. The clavicle brace is like the digit 8 in appearance. This is employed to treat clavicle fractures.
Let's now check out Knuckle Bender Splint.
The treatment of ulnar nerve palsies involves the use of this knuckle bender splint. An ulnar claw hand may develop if there is ulnar nerve palsy, and a knuckle bender splint can arrest clawing. The dynamic knuckle bender splint. Here, springs have been replaced with rubber bands. This knuckle bender splint is designed to limit MCP hyperextension to only the little and ring fingers, while the previous splint also encompasses index finger and middle finger MCP joints. Dynamic knuckle bender splint that is customized for pediatric size. This static splint made of thermoplastic is a MCP dorsal blocking splint that can be utilized in hand therapy. Opponent splint, which is sometimes referred to as the short thumb spica, is a hand-based splint which allows full wrist ROM. This thermoplastic splint wraps around the thumb. The distance between the MCP flexion crease of the second finger and IP flexion crease of the thumb is between 6 and 7 centimeters in an adult. Stretching splints for the first web space can be utilized in median nerve palsy to prevent contracture of the first web space. The same purpose is served by this splint after surgical treatment for hand injuries. The splint is constructed from malleable aluminum and can be modified. Classical signs of median nerve palsy. Split claw hand results from combined median nerve and ulnar nerve palsy. With its spring attachment on the thumb, this dynamic knuckle bender splint assists in thumb opposition and palmar abduction. This dynamic knuckle bender splint has a finger loop that has a rubber band attached to help with thumb opposition and palmar abduction. With springs on either sides projecting upwards, this type of splint offers the greatest availability of palmar surface for functional activities. Ulnar drift deformity is commonly seen in rheumatoid arthritis. Ulnar deviation and volar subluxation of the metacarpophalangeal joints are characteristic of this condition. This splint improves the alignment of the MCP joints and keeps them in the corrected position.
Repeatedly, questions about dynamic Ocusplints appear in competitive tests. So let's check out dynamic Ocusplint.
To treat radial nerve palsies, a dynamic Ocusplint like this can be used. The mobile components in this splint assist a patient with radial nerve palsy in dynamically moving the weak wrist and fingers. Radial nerve palsy is characterized by wrist and finger drop, as you already are aware. Here the outrigger portion has been detached. The versatility of this design is remarkable. The dynamic Ocusplint in action. Another dynamic Ocusplint. This is also a dynamic Ocusplint. The wrist region does not have any springs. A different model of dynamic Ocusplint. The static Ocusplints are of various types that can be seen here. The splint can be reshaped with manual pressure if it is made of moldable aluminum. A water bath is necessary for modification if the splint material is thermoplastic. As a NEET splint, a static splint can be used to support the weak wrist and fingers caused by radial nerve palsy. There are static splint varieties that can also be used as resting splints. It's important to note that static splints don't have any mobile components.
Antispasticity Ball splint is an interesting orthosis.
The Antispasticity Ball splint helps maintain the palmar arch and hand in the reflex inhibiting position with the wrist in neutral position to reduce spasticity. This splint assists in preventing contractures. In cases of stroke, cerebral palsy, traumatic brain injury, or other issues involving spasticity of the upper extremity, an antispasticity ball splint can be utilized.
Next is ovalate splint.
In boutonniere deformity, mallet injuries, and swan neck deformities, an ovalate splint that resembles the digit 8 can be utilized. A mallet finger leads to a flexion deformity at the DIP, resulting in loss of active extension of the DIP. A boutonniere deformity is characterized by flexion of the PIP joint and hyperextension of the DIP joint. Silver ring splint. This is made of metal. This is almost the same like the ovalate splint. These two splints are used in cases of rheumatoid arthritis for correcting deformities such as boutonniere deformity and swan neck deformity. These are often used by rheumatoid arthritis patients. Swan neck deformity is characterized by hyperextension of the PIP joint and flexion of the DIP joint. Buddy taping involves the use of bandages to bandage both injured and healthy fingers or toes. The normal digit functions as a splint, maintaining the injured one in its natural position while it heals. It's a well-known useful method for treating sprains, dislocations and other injuries of the fingers or the toes, especially fifth metacarpal fractures. However, use of buddy taping is an area of debate. Some studies found poor patient compliance, skin infections, limited motion of the normal or the injured finger due to the decrease in the adhesive property or elasticity of the strapping material used, and fracture displacement.
Next is mallet finger splints.
Stack splints are widely used in the non-operative management of mallet injuries. This is a soft padded aluminum splint with velcro straps used in the mallet finger treatment. Here, a slight extension is provided to the DIP joint. This is another type of splint made with low temperature thermoplastics. Perforations help in ventilation. These finger splints have soft Etherflex padding attached to moldable aluminum strips. Using malleable metal has the advantage of being easily reshaped by manual pressure. The velcro straps have soft padding that can be positioned in various locations to cover the finger. PAP joints flexion deformities are commonly treated with this type of finger splints. This is called a frog splint. This static splint, made of a malleable aluminum, is sometimes used in the non-operative management of phalangeal fractures or minor finger sprains.
Next is a commonly prescribed brace or support, tennis elbow.
This is tennis elbow brace, otherwise called a tennis elbow support. It is used in lateral epicondylitis, also known as tennis elbow. By providing proprioceptive feedback, this brace prevents excessive and strenuous elbow movements.
Now let's see what is an yoke orthosis.
A yoke splint. The position of the MCP afforded by this splint reduces the forces across the repaired site, preventing tendon rupture. Besides, it reduces the rehabilitation time. This yoke splint or relative motion orthosis was fabricated using a 3.2 mm perforated thermoplastic sheet, keeping the middle finger extended at 20 degrees relative to the MCP of the other fingers. This orthosis allows a full flexion of all the joints of the other fingers and the PIP and DIP of the middle finger as well. Kapner splint is often employed in the treatment of boutonniere deformity. This is a dynamic splint since it has mobile components such as springs. Kapner splint is a dynamic splint, as I have already mentioned. It has a spring which helps in moving the finger at the same time keeping the deformity corrected.
Next, let's discuss Turnbuckle Splint.
This is a turnbuckle. This is used for traction or distraction, as the case may be. Turnbuckle splint is often employed to treat contracture of the elbow or the wrist due to Walkman's ischemic contracture.
Next is a long splint.
The purpose of this splint is to provide an extension stop for the distal phalanx and to ensure controlled mobility of the CMC, carpometacarpal, and MCP joints. There is a malleable metal strip inside this pouch. Wrist forearm brace is a splint that is based on the forearm and hand and can be used when more support is needed for the wrist and forearm. It is possible to use this as a weaning splint after surgery or a PAP cast or slab in fractures around the wrist. These types of splints usually will have a metal or a sturdy plastic strip inside this pouch. Treating ulnar collateral ligament injuries can be done using either this splint or a short thumb spica. Skier's thumb or gamekeeper's thumb is an acute, partial or complete rupture of the ulnar collateral ligament of the thumb's metacarpophalangeal joint.
Now let's check out some splints.
This is SAM splint. Lightweight. This is made of moldable aluminum with a soft foam padding. A wrap or bandage of your preference is all it takes for a secure fit. This can be cut to the desired size. This is radiolucent and is weather resistant. A SAM splint is mostly used by emergency care providers. A very versatile splinting material. For more details, please check the description box.
Let's end the video here. Thanks so much for watching this video. Bye.